Hi, my name is Dr. Stephen Wexler. I'm a specialist in refractive surgery and the medical director of the Washington University LASIK Surgery Center in St. Louis, Missouri. I am also the medical director at Bismarck LASIK in Bismarck, North Dakota. I recently conducted an investigator-initiated study evaluating the accuracy of flap thickness and diameter in patients undergoing LASIK surgery for myopia correction at a single surgical center. Achieved desired flap thickness and minimizing thickness variability are important aspects of successful LASIK surgery. Knowing flap thickness allows for accurate surgical planning, including calculation of residual stromal bed thickness. Our prospective observational single-arm study examined flap thickness in LASIK surgeries where the WaveLight FS200 femtosecond and the EX500 lasers were used. The WaveLight FS200 is designed to help surgeons create custom flap thickness with precision and consistency. The EX500 features the ability to perform optical pachymetry, so we were enthusiastic about evaluating their performance in our center. In this study, we collected preoperative pachymetry data with the WaveLight EX500 pachymeter on the day of surgery just prior to creating the LASIK flap. After the flap was created and lifted, pachymetry of the stromal bed was taken with the WaveLight pachymeter. Subtracting the stromal bed thickness from preoperative full corneal thickness, we were able to compare intended flap thickness to actual flap thickness achieved during surgery. Planned flap thickness for all corneas was 120 microns. Calculated flap thickness utilizing the WaveLight pachymeter gave a mean achieved thickness of 120 microns, and there was no statistical difference between the planned and achieved flap thickness. 95% of the flaps ranged in thickness from 108 microns to 133 microns and varied from the mean by plus or minus 12.5 microns. Achieved flap diameter was determined by image analysis, and the difference between the achieved and intended was calculated. This difference was minimal, showing statistical but not clinical significance and indicating excellent overall accuracy. Overall, our results showed that the WaveLight FS200 laser is reliable for LASIK flap thickness and diameter and accurately created flaps at the intended thickness and the intended diameter.